for joining us for this episode of Talking Health in the 406, where we're one community under the big sky. I'm Trina Filan, a public health evaluator.
And I'm Margaret Mullins, the Social Determinants of Health Program Manager.
In January, we talked with United Way of the Lewis and Clark area about housing, houselessness, and public health. We're carrying that conversation forward today. For a few decades now, communities around the U.S. have been connecting housing and healthcare using a framework called permanent supportive housing. St. Peter's Health in Helena is using a model of permanent supportive housing called FUSE, which stands for Frequent Users of Systems Engagement. Our two great guests today are from St. Peter's Health. They'll be talking about their work with FUSE and the importance of housing stability and wraparound services to help our most vulnerable community members. Kayla Morris is the Supervisor of Community-Based Services at St. Peter's Health, and Mark Nay is a community health worker with the FUSE program at St. Peter's Health. By the way, we will refer to community health workers as CHWs throughout this podcast, so those two are the same thing. Welcome to you both.
As we discussed in our January podcast, housing is intimately related to health, and housing instability exacerbates poor health. To repeat a couple of statistics from the National Healthcare for the Homeless Council, people who are unhoused have higher rates of illness and die on average 12 years sooner than the general U.S. population. People experiencing homelessness have at least twice the rate of chronic disease than people who are housed. For instance, rates of diabetes are about 9% for people who are housed and about 18% for people who are unhoused. Rates of high blood pressure are about 29% for people who are housed and about 50% for people who are unhoused. Furthermore, according to the Montana Healthcare Foundation, about 5% of patients account for about 50% of healthcare costs. We'll make sure to put links to some useful resources in the show notes. It's really important to underscore that having stable housing opens the possibility for people to stabilize their physical and mental health. Montana cities and healthcare systems have been investing in connecting unstably housed people to housing and healthcare for quite a few years now, and St. Peter's Health in Helena is one of those implementers. Kayla and Mark, can you each tell us about your roles at St. Peter's and how you got involved with the FUSE specifically? Why don't we start with you, Kayla?
Yeah, thank you. So I actually had worked at St. Peter's Health for a few years prior to moving into this role. And upon completion of my undergraduate degree in public health and health sciences, I noticed that there was a position available on our population health team, and I thought that I would apply. And so once I accepted the position, I learned that this role was to implement our Housing as Healthcare program, which was initially grant funded through the Montana Healthcare Foundation. So at that time, my whole goal was to figure out how St. Peter's Health could get involved in the housing space and permanent supportive housing and really utilizing the FUSE framework. So some of that background work had already been completed in a prior planning grant with our partners, which is great. And so once I got on board, we got to work, and from there, we decided that community health workers would be a great way to move this work forward. Hand that off to you, Mark.
Yeah, thanks. Prior to working for St. Peter's Health, I was the street outreach coordinator for Good Samaritan Ministries here in Helena. And so I worked directly with our unsheltered population in town. And working with Good Samaritan, I found myself really connecting a lot with who was the current community health workers at the time. So I worked real close and built a relationship with the community health workers. And so when an opportunity came about a year ago to apply to be a community health worker, it seemed like a really natural fit for me, and I was really fortunate to get the position and continue to work in this role today.
Awesome. Thank you very much. We will talk more about CHWs in a couple of questions from now. But Kayla, can you please tell us the when, how, and why of St. Peter's developing the FUSE program in the first place?
Absolutely. So the earlier time before buy time is going to be a little bit fuzzy, but from my understanding, I believe in around 2019, St. Peter's Health was awarded a planning grant for looking into the housing as healthcare model that Montana Healthcare Foundation was doing across the state. So it's my understanding that Helena was a part of their second cohort. So we were able to learn from some of the places before that. So that initiated the initial work between St. Peter's Health's population health team and the United Way of the Lewis and Clark area and the Helena Housing Authority. From there, they worked collaboratively with a consultant, the Corporation for Supportive Housing, who actually created the FUSE process to really help bring FUSE to our community. And so through multiple public meetings and collaborations with our community, we decided to move forward on that implementation grant. And so one reason St. Peter's Health found it important to get involved in this work is just because of the link that housing plays on a patient's health outcomes. So we know that a majority of our healthcare utilization comes from a small percentage of our population, and those individuals often have unstable housing situations or don't have homes to begin with. And so if we could intervene in an upstream approach and get community health workers on the ground, help connect patients with housing, and help sort through all of their community needs and their wraparound services, we would be able to implement their health outcomes in a greater way. For example, our doctors and our nurses can provide the best care, outstanding care, evidence-based care. And if someone's leaving the hospital and going back to an unsafe, unhealthy living situation, that care doesn't matter in a sense. Their living situation is going to prevent them from follow-up care. It's going to prevent them from taking their medications, following their care plan, and they're going to wind up right back in the emergency department or hospital with an exacerbated medical condition. And while that's costly to our community members, it also creates bottlenecks in our emergency department. And having limited resources in a small town and a growing population at the same time, that leaves a lot of concern. So if we have people in an emergency department who don't necessarily need to be there and could have avoided that through either preventative primary care or simply going to primary care for the reason that they're in the emergency department for, we run into a bed capacity issue. And what happens there is you and I might need the emergency department for a heart attack, or maybe we get into a car accident and we could show up and there would be no beds available for us. And that's a concern. And so as the area's only hospital and emergency department, we found it really important actually to ensure that our community has appropriate access to care and that we can really impact the health outcomes of people who have limited access and high social determinants of health.
And it seems like the folks that are served by the FUSE program have other systems engagement, right? So not just a lot of emergency department use, but perhaps other systems in the community that need to respond to folks who might be in a crisis. Can you talk a little bit about those interconnected services and people's complex needs and how FUSE helps folks with all of that stuff?
Yeah, I'd be happy to speak to that, but I actually think Mark might be able to speak to that better.
Yeah, that's a really good question, and outside of the individuals that we work with frequently accessing emergency rooms, one of the things that we found is, and particularly with being out on the streets and working directly with people on the streets, is we see often kind of high utilization of law enforcement. And so one of the things that happens is people living or experiencing homelessness and living on the streets, each day can really present its own crisis. And so one of the things that happens is often 911 gets called and law enforcement is getting dispatched to the scene to help people. And that can really have a negative effect on the individuals that we work with. Often, many of them have a lot of trauma associated with previous experience with law enforcement, and so to be able to come more as a plain closed person and somebody associated more with medical care, we've been able to really step in and intervene in situations within the community.
And Mark, this is a little bit of an extension of that, but could you just talk a little bit about why community health workers, as a community health worker, are integral to that success of a program like Fuse? You mentioned, sort of intervening where law enforcement might come in. Are there some other ways that you can explain how CHWs are integral to that process?
Well, I think, the greatest benefit that we have and that I've noticed from my own life is really just lived life experience. And so, speaking on my own life, I struggled with substance use, and my own life was impacted by interactions with law enforcement. And so, to have to have not just experienced the things that I've experienced, but also to have learned how to come to the other side of those things, I can offer really just a different perspective to individuals going through the crises of their lives. And oftentimes, like law enforcement plays a very specific role. And one of the real neat things about a community health worker is we get the opportunity to play many different roles. And so I think that's really just we can be kind of fluid in how we're working with people on the streets.
That to me sounds, when you talk about the success of the Fuse program, having somebody right out there, it's one thing to have a program and let people know your program exists, but to have somebody who's on the streets, like you say, with experiences that they can really make sure people understand what services are available to them. I think that's amazing. How many clients, Mark, do you work with on average?
It varies. Because of the real high needs of the individuals that we work with, I think really at the most that we would probably have would be 15. But one of the things that we really try to be attentive to as a community health worker and attentive to as part of the Fuse team is responding to what our community presents to us. So yes, I might have, anywhere from 10 to 15 people that I work with on a day-to-day basis. But that doesn't mean that we shut down our services. And so, if we receive referrals, we'll try to do a lot of spot interventions. And if we can go to the shelter, if we can go to the streets, or if we can go to another organization and intervene and help somebody kind of find a road to a better outcome that day, we're very willing to do that.
Yeah, remaining flexible, I guess, through the whole process is pretty important. How long do you spend in general? Like, you have all these clients. I know things are often an ongoing process. Is there sort of a timeline or a beginning and end to how some of that goes?
So what we've seen over the, almost three years at this point of this program is that the average participant is participating in the program for about a year and a half. Some will participate in the program for the rest of their lives. However, our Fuse services are they're intensive, right? And they're ongoing. So a lot of programs you see will work with individuals in different stages of their life. I'll only work with you while you're on the streets. I'll only work with you once your house. I'll only work with you for 6 months. And the whole point of our community health workers is to bridge that gap and not to replace services, but to ensure that our clients are connected to the right services around them. And so that leads to long-term ongoing engagement. And so our community health workers really know their people. They know the people they work with inside and out. They're often a resource for our other service members in the community. And so if you're embedded in the Fuse program and engaging in the program and working through the program, it's on average about a year and a half until they're at a place where they are stabilized, they have the right connections around them, and our community health workers really can start stepping back. And when that happens, they're still available by phone, by email, by texting, by whatever means necessary. However, we see once people are stabilized, that maybe moves to like a every few month check-in, just saying, hey, I'm doing well. Thanks for caring about me and supporting me. On the other side of that, Mark was chatting about how we respond to our community's needs. And so we will work with people on an add-on basis. So they're not fully in the Fuse program, but it's filling that gap, meeting that immediate need. And those are much shorter stints. So that might be a day or a month or somewhere in between those lines.
Right. It sounds like CHWs are a really important part of bringing the whole wraparound service safety net concoction that we have in town into a wholeness, right? Instead of there being a gap that people fall into, CHWs can be the bridge to help people over that gap and into the next part of their journey.
It doesn't surprise me that, when you mentioned some people are in it for a lot longer than that, because people's needs change obviously over time. So, one sort of serious situation or crisis may be diverted and another will surface, right? So it's very much work that continues all the time. When I listen to the variety of things that must come across your plate on any given day, Mark, this is for you really. I'm kind of wondering, what sort of support does a community health worker need to be successful in this role? Because it seems to me you could get pretty exhausted, maybe burn out in the process of trying to help so many people in so many different ways.
Yeah, that's a great question. I think first and foremost, one of the things that really I suppose prevents burnout in my life is I really, really love what I do. And so I found something that I'm passionate about, something that I enjoy thoroughly. And so burnout's not as, for me, as common as it you might think that it is. But the other thing that's been really, really important is I love the organization that I work for, and I love the people that I work for and with. And that includes Colette, our other community health worker. She's an incredible partner, but also working and collaborating directly with Kayla. And Kayla really does a tremendous job of really supporting me, and I think the coolest thing is she really encourages me to be me, and that just, I don't know, it's a really a comfortable place to work, and it's and that makes it really easy to go do my job. On top of that, we check in with each other frequently, and I'm given a safe space to really express what my needs are and what my frustrations are. So I'm blessed. Like, it's what a great job, what a great organization, what a great team that I work with.
And what a fantastic thing to hear. Like, that energy that you have for this job, I'm sure resonates like in all the work that you're doing. So that's excellent. Really nice.
Yeah, and I've seen you talk about your role both in your past work with Good Sam's and in this context, and it's clear that you're really passionate about helping the people you help, and that it gives a lot of satisfaction. So thank you for doing that.
Yeah, thank you.
Mark, I've heard you talk before also in a couple different situations at conferences, or I think St. Pete's had one of their panels last year that I was at. But at any rate, I'm always really amazed at sincerely your energy for the work that you do. It's really 15 people at once. I wasn't expecting, I don't think, that many at once. Like, that's a lot. And when I hear about the actual hands-on stuff you do, help people move, like load trucks up, get their stuff moved, I'm thinking 15 people at once. Holy smokes. It's a lot.
And so one of the things that I've had to learn in this deal, and it really is different than street outreach in some ways, but let's look at the 15 people that I work with. Now that's juggling 15 people, but within each one of those people, it's helping them to juggle their very complex needs. So you're not just juggling the people, but you're juggling all of their needs and trying to keep track of that all, and really I guess point people to maybe what might be the best direction and the best outcome for them. It can be tricky. It can be really tricky.
Yeah. You can't just say 15 people and they each have a need. Each person.
No.
They each have 100 needs at the
100
same
needs.
time. And so when we actually started this project, we, looking at all the evidence-based literature, right? They suggested community health workers should work with somewhere between 25 and 50 people each. And so I was like, well, let's start with 25. And it was evident immediately that we need to back that down to 15 max, or else no one gets the help that they need.
Yeah. And you need to have good relationships with all the different people in town, right? Like you have to be able to talk to the police and the sheriff and the firefighters and the mental health folks and food bank and the housing folks and all those.
Well, I think one of the things, that I really look at in the role of a community health worker is it's really becoming an expert in relationships. And so, it seems that I'm asked to do a lot of things, but, to be an expert in building relationships is probably one of the most important things that I can do. Because if I can point people to who the experts are, because I have a good relationship with them, that's really what's going to give the people the best outcomes. So being an expert in who experts are.
You make me think, and I would have to look back at the CHW curriculum, but actually, that relationship building, is that sort of a part, do you happen to recall, in the sort of CHW training, if they do something like that?
That's a good question. I would imagine that was a piece of it. I also had an understanding when I was doing street outreach.
Sure.
Is really like my job was to kind of connect people and help them to bridge the gap. And so, even in a community health worker, a lot of times I get asked to be a counselor, and I get asked to be a peer support, and I get asked to have, to be a doctor, and I get asked to be a licensed addiction counselor. But the reality is I'm none of those things. But I would be best served by knowing who those people are. And so I can point people to somebody that does specifically that. And so I think that's a big part of our job, is to really bridge the gap back into the community and help a person to build a relationship, not just with the healthcare system, but to build a relationship with their community. And if we can look at the community as a healthcare system in itself, then we should be able to really help people have some pretty good outcomes.
Kayla, a lot of folks might be interested in the kinds of data you're able to gather from this great work that you do. Do you have any statistics, cool stuff that you think folks would like to know?
Absolutely. Data is so important in these efforts. So what we find is that within 6 months of working with a community health worker, on average, we see a reduction in acute healthcare utilization by 52%, which is huge. And that amounts to an estimated $1.3 million in healthcare charges. So that quote was actually from the first 6 months of the program. So that was specifically looking at 30 patients that we worked with in the first 6 months. Other than that, what I can tell you is that so far since April of 2022, we have worked with 82 Fuse patients, 63 add-on patients, so filling that short-term need. So a total of 145 individuals in our community with 2 community health workers. Of that, we've helped 33 patients find housing, of which 11 of them were housed in the last calendar year. So really hats off to our community health workers. These are some of the most challenging individuals in our community to find housing for. Last year alone, our 2 community health workers completed 3,200 patient contacts, of which that was 1,600 care coordination hours spent with patients. 6 of our patients were successfully connected with inpatient treatment, which is really just incredible. We have provided 253 rides since we got company vehicles through some grant work and donors and partnerships for our community health workers. So we've really been able to help close that transportation gap that exists in Helena. On the justice side of things, we see that within the first 6 months of connecting to a community health worker, there's a 66% reduction in Helena Police Department calls for service, an 89% reduction in total incarcerated days, and a 92% reduction in jail bookings into our Lewis and Clark County Detention Center. So really impactful things that I think our community members care about. Just some additional stats, we found that 37% of our Fuse patients had 0 emergency department visits after engaging with a community health worker, which is huge. And 78% of those Fuse patients had less than 3 ER visits post working with a community health worker. When before that, part of the requirements for being in the Fuse program is being a super utilizer. So
what constitutes super utilizer status?
So for the Helena Fuse program, a super utilizer would have 5 or more emergency department visits and a 1-year look back.
That is amazing and impressive work.
So the other thing that I think is important to call out is understanding that St. Peter's Health is the only ambulance service provider in our county. That's critical to public health and human safety. And so prior to engaging with a community health worker, our Fuse clients had on average 3.5 ambulance visits. And within 6 months of engaging with a community health worker, that dropped to 1.5 ambulance visits. And so given that we have a limited ambulance resource in our community, that really just guarantees access for you and I if anything were to come up.
That's really impressive information. And it is something that folks in our community should know, right? There are lots of folks who may not know exactly how much work is being done to bring stability and health and well-being to so many folks in our community. So thank you for providing those data.
Yeah, and I kind of have a follow-up question to that. And you've answered some of this. I mean, we clearly know that the Fuse program helps reduce emergency room visits, and some of the stats you've just mentioned make it clear, the benefits. But I'm kind of interested to know why it's important for an organization like St. Peter's Health to take a leadership role in health and in housing and healthcare.
It's a really great question. So as the only health system in our area and the largest employer in our county, I would argue that we have a fundamental obligation, especially as a nonprofit hospital, to engage with our community and to meet our community's needs. On our community health needs assessments for multiple years, we have identified housing, chronic disease, and substance use disorder as priority areas. This year, we have access on there as priority areas. And so it's our responsibility not to solve the problem, but to help solve the problem. And so we can convene with our community partners. And when we come together, we can cross the silos of systems that are traditionally siloed and figure out how to work together and really better improve outcomes. And so at St. Peter's Health, we're lucky that we're able to help be the capacity builders and help be the backbone supporting organization to drive meaningful work further. And our population health team does a wonderful job in this arena across multiple different sectors. And so really, health systems have the ability to positively or negatively impact their community. And I feel very passionately about the fact that St. Peter's Health cares about our community. We care about improving our community. We care about our partnerships with our community organizations. And we care about utilizing the resources we have to improve health across our entire community and service area. Healthcare is so much more than just coming to the hospital when you're sick. It's so much more than sick care. It's not called sick care. It's called healthcare. And if we want to improve our community members' health and well-being, it starts with showing up at the table and understanding what our community needs and helping figure out how we can creatively meet those needs.
Thanks, Kayla. That's an amazing outlook on how we should be treating healthcare. And Helena is lucky to have the Fuse program in place and such great work going on. It's amazing.
So it seems like a program like Fuse is probably not like a straight shot to wild success every single time, right? That it's not linear, that you may have a couple of things that don't go quite right and you need to keep pushing forward. So how do you keep the folks who need to make the decisions to keep your program going? How do you help them see that bigger picture? How do you help the community see that long term when sometimes things are tough?
There's a lot of scrutiny that can happen, right? Especially when financial margins get tight. And I think one thing that helps our organization understand who don't see the work that our community health workers do every day, right? I'm lucky that I get to speak with our community health workers. I'm lucky to lead this team. And I feel like I have a fairly good understanding of what's going on a day-to-day basis, but not everyone does. And so we start with showing the data and the impacts. We have stories we tell, and we have buy-in from the people lots of people matter, right? But our physicians our physicians carry a weighted voice, and our physicians love our community health workers. They're so thankful for our community health workers. They find so much value in how they're able to help their patients move forward. Our emergency department physicians, we're starting a peer support program in our emergency department. And one of the doctors said, so that means we're going to have more Mark Nays available in the emergency department all the time. That was huge, right? And so word spreads and it travels fast. And just the outcomes and the support that they're able to provide to our patients and our nurses and our physicians and everyone else across our health system at all different access points, I think really helps to drive this forward and help our organization understand how important this work is to continue and hopefully expand someday. With that said, we have an excellent foundation team who helps us get philanthropic donations. We write a lot of grants, and we're really looking forward to the day that hopefully Montana Medicaid is able to provide reimbursement for community health workers. And so Medicare recently, last year, started providing reimbursement for community health workers, which is great and helpful. And so once we can get reimbursement across the system, we'll really be able to expand community health workers, not only within our organization, but statewide.
Mark, do you have something to add?
Yeah, that was a really good question, and Kayla explained that really well. But kind of the first thing that came to mind, and I'm not so much always involved in the community big picture look at this because I'm more of the hands-on day-to-day working with individuals. But the first thing that came to my mind when we talk about sharing with our community what it is that we do is data, and so that's the big reason why we collect data is to show what the impact is of actually helping people. And what we've come to learn is that it is not just the right thing to do to help those that need help in our community, but it is also very cost effective to help people rather than not help people. And so we want to paint a picture to our community and those that think any pockets within our community that thinks it's not worthwhile to help some of the people that we're helping is we can show them some of the cost savings and the benefits and how the overall cost savings do affect and impact our community. Now on a day-to-day basis and really trying to stay steady with people. One of the things that I love about my job and the people that get referred to our program is oftentimes the individuals that get referred to Fuse. Many organizations have already worked with, and they just don't know what to do with them. And so we get the opportunity to really step in with really probably the most complicated in our community. And I look at it as my job is to not push this person away, but no matter what they have going on in their day is to keep showing up for them. And over time, what happens, and it doesn't happen immediately. And as you asked in the question, there is an incredible amount of really ups and downs and successes and failures and forwards and backwards. But what's important to build the relationship is we keep showing up, and we keep showing up for our people no matter what. And in that, over time, those little backward steps become less and less, and forward progress becomes more and more. And we're able to, over time, and just through a real steady approach and not giving up on a person, is point them to some much better outcomes in their own life, and not just that, but really help instill within each patient that we work with beliefs in themselves, and you start to, it's really incredible because you see human beings that really believe in this idea that they start to realize that they can, and when they start to realize that they can, incredible progress happens, and we start to see them build a relationship with their very best selves, and that's a beautiful thing to watch.
Yeah, you get to help people remember their essential humanity, their dignity, and their value as people in the world. And that's wonderful.
And you make a really great point. I mean, some of those stories and some of the difficulties of moving forward and moving backwards, that's real life, that's reality. And, you also mentioned data, right? People sometimes don't want to be bothered with numbers, but the data, it's important to be able to show people what that looks like on paper, because some people don't understand what that boots on the ground day-to-day activity entails. Maybe they just relate to the numbers, and the dollar figures do matter too. How does that work out for an organization like St. Peter's? And so those things all come into play. You also brought up something, Kayla, about the doctors being so supportive, and all the staff, frankly, it sounds like, is supportive. I think that's a really important thing to highlight, that when you're in an organization, especially as big as St. Pete, you need to have some support from everyone involved. It's really hard. You can't act in a silo on something that's this huge and that has this much overlap with everybody in the system.
I think one of the most important pieces of really ensuring that our stakeholders understand the value of this work is knowing my audience, right? And so before I answer someone's question or communicate the value of this program, it's really important for me to understand what they care about, right? Because I don't have 3 hours to tell them everything that our community health workers do and how this impacts. And so my ability to understand what pieces they're going to find the most valuable and tailoring my messaging to that, I think is really a key component, right? When we talk to our county and city officials, they want to hear something different than our hospital executive leadership team, who wants to hear something different than maybe a nonprofit who's just curious, or maybe a concerned citizen who's skeptical, right? And so really, I think the relationships our community health workers have been able to build with our community, the data that speaks for itself, and just an understanding and an appreciation and a value and a belief in this program helps to drive that messaging.
One of the things I really wanted to comment on as we talk about how our doctors and our care teams see us within our organization, and they are really supportive of what we do. And I think it's so important. And the reason that we have community health workers is that allows the doctor to be the doctor, and that allows the nurse to be the nurse. And that lets me kind of step in and do the things that a doctor and a nurse that they shouldn't have to do. They shouldn't have to be an expert in the community, and they shouldn't have to be an expert in where does somebody go to get food. That allows them to focus on really put all of their energy into the care of the people that they're working with, and allows us on the back end to take care of all of the things that we can help with within the framework of the community. And so I think that's an incredible part of what a community health worker does. And as well, when we talked about the community health worker training that we did, one of the things that really stood out to me was this comment that the role of a community health worker is to enhance the care being offered by the care team. And so we're really able to give some voice within the community, give reminders to the people that we work with of what the doctor and the nurse is really looking and expecting from the patient.
Yeah, and you summed that up beautifully, Mark, because it's really clear to us in some of the work that we do that healthcare providers themselves being asked more and more to address social determinants of health, they lack capacity. They may have the heart and the will, but they don't have the capacity. And as you just said, community health workers really step in that space to help them meet the needs.
And I just want to reiterate the importance of the community health workers as it relates to social determinants of health is so important. As we know, 80% of your health outcomes are factors outside of medical care. So you can provide the best medical care in the world, and without addressing the social needs that individuals have, that care it's not going to long-term take the effect that we're hoping it will. And so having the experts in the social aspect, right? Being able to meet patients where they're at and really understand and get the true story that's going on, because they feel comfortable with the community health worker to say, hey, I actually don't have a place to store my insulin. That's why I haven't been taking it. It's not because I'm afraid of needles. Is important, and it's valuable, and it helps us get the outcomes we desire for our patients, and our patients get the outcomes that they desire for themselves.
Absolutely. It's that whole wraparound of services and need that people have, and no one entity can fulfill it all. This is so much great information. We've asked a lot of big questions. I'm just curious if you have anything else you might want to add or, to the conversation today.
I might just say that if there's individuals who are listening who are interested in starting a community health worker program, especially within the health system, I encourage them to do it. It can be an uphill battle. It can be difficult to help explain to stakeholders the importance and value of a community health worker, especially if your state doesn't license them, right? I remember often hearing, what do you mean you're going to send an unlicensed individual into a patient's home to help them with their medical care plan? And I understand why that created some concern for individuals. And so it's worth it though. And I encourage it. And I think that there's some critical things that you'll learn along the way. But one of the things we learn the most is our community health workers have a debit card available to them that they can put just the random expense on. Sometimes you need to buy someone a cup of coffee to get them to engage that day. And we want to make sure that we're not missing our ability to connect with individuals over a small expense. Having company vehicles, that has allowed us to solve a transportation barrier in a community where we don't have fantastic public transportation. And ultimately, I think leadership is really important. Leaders need to really understand what's important for a community health worker and what that role looks like. I often joke that if they're in the clinic too much, they're probably not doing their job super well. They need to be out in the community, right? And so sometimes you end up in situations where I've heard about times where community health workers are primarily in the office. And with being within those four walls defeats the purpose of the community health worker, right? It's to get them outside of those four walls. And so really, I think I would encourage any leader who supports community health workers to really listen to your community health workers, to hear what their needs are, to hear what their struggles are, and allow them that safe place to vent. Their jobs are taxing, and everything we can do to get out of their way and help remove other barriers and support them in it, I think really adds long-term value and success to your community health worker program.
And St. Peter's Health Fuse program is certainly an amazing example of just that. All of those things are happening in this community, and your CHWs are doing astounding work. So I thank you.
Well, that was very well said by Kayla. And I think if I was to maybe just to kind of close up, I get asked a lot what a community health worker does. And here's what I would want people to know about what it is that we do is I look at it this way, as I help people create a roadmap to their own health. And we look at health in two ways. And we look at health as doctors and medicine and the standard healthcare system. And that is a critical part of a person's health. But it's also really important to recognize, and I think my role as a community health worker is to help our community and individuals know that the other part of health is, what is your relationship with your community? And how do you find health within your community? How do you find connection? How do you find food? How do we make sure that you're insured? How do we make sure that you have the things that you need? And how do we connect you to build a really healthy relationship with your community? And if you can combine those two things, doctors and medicine, and a healthy relationship with your community, then the outcomes for the person are really incredible.
Thank you so much for that. I think that's absolutely true. And it's a living example right here in Helena. So thanks again to both of you, Kayla and Mark, for the time that you've taken today. And thank you so much on behalf of Trina and myself and the crew behind the scenes. Thank you also to our guests who are working intently on developing comprehensive housing and care services for people experiencing housing instability and homelessness. If you would like more information on what was discussed today, visit our website at talkinghealthinthe406.mt.gov, where there will be links to the information discussed. And if you haven't already, please remember to rate, review, and subscribe to our podcast. And until next time, be healthy and be well.